Okay, a lot of people think that they need to eat for two while they're pregnant, but actually, this is not true.
Right, a very good afternoon, everyone. And today on the Medic Experts podcast and the talk show, we have Dr. Doris Ng, who is a consultant obstetrician and gynecologist from Columbia, Asia, Petaling Jaya. So Dr. Doris is an old friend of mine, a very good friend as well. And she graduated from the University of Adelaide in 2007, and she obtained her MRCOG from the Royal College of Obstetricians and Gynecologists in London, UK in 2017. So today we are very honored to have her with us, and we are going to talk about what you can do in pregnancy to optimize your condition and also for the baby's health. So today I think we will start off first by talking about the eating well and the right nutrition in pregnancy. So, Doris, maybe you can say a few words and just introduce yourself to our audience.
Thanks for having me, Dr. Kwan. I'm very honored to be here today, and I hope that this brief introduction into healthy eating and pregnancy will be helpful for all our pregnant mummies and soon to be pregnant ladies out there.
All right. So here's the first thing that we want to ask you, just a very general question, Doris. Now, what should a pregnant mother eat?
Okay, a lot of people think that they need to eat for two while they're pregnant, but actually, this is not true. Generally, we still need to continue our usual healthy lifestyle diet whilst we are pregnant. So this includes the concept of the suku suku separuh, where half of our plates are filled with fruit and vegetables, a quarter with healthy carbohydrates like whole grains like brown rice, or less refined foods like noodles, okay? And a quarter should be lean protein in order to meet all of the mother's nutritional as well as the growing baby's nutritional needs.
Right, that is so useful because my mom used to always tell me when I was pregnant, remember, you're eating for two, you have to eat more. So that's not necessarily true. And is that also why people eat too much? Is that why they have difficulties losing weight after that?
Yes, so the old myth where you have to eat for two, I always tell my ladies, if you really eat for two, you end up the size of two people. And that will make it very hard for you to lose the postpartum weight later. On average, if you're a healthy BMI, we should gain anywhere from 5 to about 18 kilos throughout our pregnancy. Obviously, if you're a bit on the heavier side before you got pregnant, you shouldn't gain as much weight as somebody who is perhaps a little bit underweight before they got pregnant. So in the first trimester, we actually don't need to increase our calories very much at all. And in the second, third, and in the breastfeeding, or sometimes also known as the fourth trimester or the postpartum period, our calories can increase by about 200 to 400 calories. And to give you an example of how much 200 calorie is, it's the equivalent of two slices of bread or one bowl of rice. That's it. You don't really, really have to eat for two.
Wow, that still sounds like a lot to me, though. Yeah. So our other question is, a lot of people, especially Chinese, they believe that there are certain things you can't eat during pregnancy. So a lot of people say, you cannot eat pineapple, for instance. So is that true? Are there things that we should avoid?
Okay, there are definitely things that we should avoid, but pineapple isn't really one of them, and I'll go to that in a bit more detail. Some of the things that we definitely should avoid are, I would always tell my ladies that we don't eat raw or uncooked foods. So, for example, let's take eggs. Okay, eggs are really healthy. They're a good source of protein. They have lots of protein in the yolk, lots of iron, which a lot of us are deficient in. So eggs are really great, but they have to be cooked really well because if they're not cooked well, they carry the risk of bacteria such as salmonella, which can cause severe food poisoning to the point of causing miscarriage. So this unfortunately goes on to raw or semi-cooked food like sushi or sashimi. Unless it's fully cooked, things are piping hot, even cold meat such as, the chicken ham and cheeses that we get from the deli. So
Mm.
hard cheeses like cheddar or parmesans are fine, but soft cheeses like brie or camembert should be avoided, and blue cheese, which has kind of yeast inside, all of these should also either be avoided or cooked until really hot because they carry other bacteria such as toxoplasmosis, which again carries the risk of miscarriage.
Oh, I
And now,
see.
to
Pardon?
get back to your question about the pineapple, all
Yeah.
right, pineapple does contain an enzyme called bromelain. And bromelain is an enzyme that breaks down protein and is very efficient in breaking down the protein that contains in our cervix. So it's thought that eating pineapple can potentially ripen the cervix as well as induce labor.
Mm.
However, the amount of pineapple that you need to eat to achieve this effect is a lot. We're talking like 5 to 7 whole pineapples. Many women have safely enjoyed 1 cup of fresh pineapple a day without any problems. Okay, but this is where the old wives' tales come from. So if you really, really crave for pineapple, because women do have lots of food cravings or food aversions in pregnancy,
Mhm.
it's totally safe to consume fresh pineapple. Okay, and cooked pineapple definitely has no more bromelain inside. So cooked pineapple is also safe to eat. But because pineapple is really high in acidity, it can worsen heartburn and cause acid reflux, which is already a huge problem in a lot of pregnant women. So that's why some people say it's safer to avoid this kind of. But in terms of
Mm.
causing miscarriage and inducing labor, you'd have to take a really, really crazy amount of pineapple in order to do that.
That's very enlightening, Doris. Thank you for telling our listeners that so they don't really need to worry. So my next question is, what about steaks? Can they eat if it's well cooked? And what about alcohol and say things like teriyaki sauces? Do we need to worry for that minute amount?
Okay, so steak can be eaten. So any sort of meats, chicken, lamb, fish, beef, all unfortunately needs to be well cooked. So if you're the
Mm.
type to enjoy your steak medium well, unfortunately, again, this is not advised during pregnancy due to the risk of bacterial contamination, which can cause severe food poisoning that leads to miscarriage. And in terms of alcohol, there are no studies to prove that there is a safe limit for alcohol in pregnancy. So our advice is to avoid any amount of alcohol at all.
I see. Okay, so we really do need to be careful about what we eat, and we have to check the labels and everything of everything we buy. So my next question is I think it's a simple question because my ONG told me when I was pregnant you shouldn't take any traditional medicine or herbal medicine when you are pregnant. So, but some people were also telling me on the other hand, you must take like bird's nest so your child becomes fairer, or chicken essence. So, what are your views on this?
Okay, so the thing with traditional herbs is that sometimes they do contain certain active ingredients, but we are unable to quantify what those active ingredients are and specifically their dosages. So,
Mm.
for example, a lot of people like to take ginseng and cordyceps because it boosts energy, because pregnancy is so fatiguing. Like a lot of people in the first trimester, they say they just feel so exhausted all the time.
Mm.
So, uh, however, when you take these kind of things, okay, it things that promote blood circulation, especially so such as ginseng, cordyceps, dongquai, these things, when they promote blood circulation, pregnancy is already a condition where our blood circulation is in hyperdynamic mode, where our body
Mm.
is increasing its metabolism, it's providing a lot of blood flow to the placenta, so, in some cases, yes, this can lead to potentially bleeding, especially if the placenta is not fully formed yet, so in the first trimester. And I would tell my patients, especially towards the end, when they are going to deliver, so are they taking any herbal supplements? And if yes, which one should they stop? So not every supplement should be stopped, but everything you do need to inform and discuss with your healthcare provider. Better yet, if you can bring your bottles or your supplements to show your doctor, to check with your doctor, is this safe for me to take while I'm pregnant? And don't forget to review it regularly with your doctor, because sometimes we ask in the first trimester and they say, oh no, I don't take anything at all. And then suddenly when they give birth and we run into complications such as a heavy bleeding or hemorrhage, when they are delivering, we ask them, did you take anything? Oh yes, actually my mother-in-law or my sister or my, family recommended that I take this. And, we forgot to check back with them, or, maybe the mummies forgot to inform the doctors beforehand. So yes, there is a grain of truth in it, but not everything needs to be stopped. So this is something that you definitely do need to check with your doctor.
I see. So basically, if you're not sure, check with your doctor. Always keep the doctor informed about what you're doing. Yeah. What
Exactly.
about,
Yeah.
does bak kut teh, does it count as herbal?
Okay, so some people are worried about bak kut teh, okay, because every restaurant has their own secret blend of herbs and spices. All right, I always tell my ladies, look, unless you're eating it like 3 or 4 times a week, okay, if you're having it just once in a while, it's safe to consume. Unless, of course, if you do have a condition where you are already bleeding, then I might tell them, if we're not really sure what's inside, okay, best to avoid it for now.
Okay, that's really, really useful advice for everyone, especially for our Chinese listeners who love their bak kut teh. Yeah. So I think in summary is, you need to be safe, make sure what you're eating is cooked and healthy and not overdo things too much. So Dr.
Yeah.
Doris, do you have any take-home messages to tell the listeners today so that they can remember, in a nutshell, what do they need to know?
Okay. So I would say the take-home message is don't eat for two.
Mm-hmm.
Always remember to eat enough of your healthy fruits and vegetables, your whole grains, and your proteins. Okay, in terms of foods to avoid, yes, some things do contain a grain of truth in them, especially regarding those old wife tales. But if you're not sure, just check in with your doctor, and we're more than happy to help.
All right. Thank you so much for the very enlightening talk that we and chat session we had today. And I think if any of our listeners have any further queries, they can always reach out to us at our website. And if you'd like to see Dr. Doris in person and consult her for anything that you want to know, or, if you're pregnant and you're looking for an obstetrician who is good, then you can consider Dr. Doris at Columbia Asia and you can make an appointment to see her there. All right, so that's all for today, and we're signing off. And thank you so much for listening. And thank you, Dr. Doris, for coming on board today.
Thank you very much.
All right, see you again. Bye.